Hello everybody and welcome to this week's vlog about sciatica. This is part one of a two-part series. So this week is much more me talking. Sadly, I have no special guests with me today, so it's just me, sorry. And then next time I'll be showing a few exercises to help try and ease the sciatic symptoms. So I've just produced, let me just share this screen. So produced a few slides for you to have a little look at. So basically, sciatica, is it true sciatica or is it just a referred pain? Lots of people come into the practice and say, oh, I've got sciatica, and they have a leg pain, but it may not be true sciatica. So what is true sciatica? True sciatica is when the sciatic nerve gets impinged. So we can see here on our spine, so this is our sacrum, the base of the spine, and this is the pelvis bone, and then this is the lower back, and the nerves come out of the spine and the upper part of our pelvis to form this very large nerve, the largest nerve in the body and the longest, and it runs down all the way down the leg to the foot. So let's go. Basically, sciatica is a symptom rather than the actual disease process. Something else is causing you to have the pain in your leg. So what are the symptoms? So if you've had it, you'll know that it's this horrible, just unrelenting pain that just won't go away. And it keeps you awake at night, and you find that it's very hard to find a comfy position. So here we have our sciatic nerve. So you get pain in your lower back where the issue probably starts. You could get pain in the buttock, back of the leg, leg and foot. Because it's a nerve, so if you think of nerve like an electrical cable, you have the insulation part of the cable is our sensory part of our nerve, and then the wire part of the cable is our motor part. So the sensory part gives us then pins and needles, which we can get in the foot and in the leg. And then the motor part is basically the nerve supplying muscles. So it's common if it's very, very impinged, you can get a foot drop with it, which is where somebody walks and they have to slap their foot because the back of the leg muscle, the gastrocnemius, isn't working properly, and soleus. So most people come in and they stand with their leg bent. So if you think you've got an issue with the nerves don't stretch very well. So as soon as you have a straight leg, it just pulls back to the original part in our spine up here, and just tethers that nerve, and the pain just lightning pain down the leg, horrible. So again, if you have a straight leg and then you go to bend, that's even worse. Horrible, because it stretches all the way through your spinal cord. And again, because your spinal cord is attached to the sciatic nerve, because that's where it comes from, then it really, increases the pain. So here are some of the reasons for getting sciatica. The disc problem is probably the most common. So I'm just going to clip onto the slide showing our discs. So these are our vertebrae, and this one here is a nice, normal, healthy disc. Now, basically, you're looking as though you're being chopped across the top, so a cross section through our body, and you're looking down on the vertebrae. So this is the disc here. I'd like to describe it a bit like a donut. We have a sort of a soft center, a jammy bit in the middle, and then the pastry bit is the outer fibers. So over time, we can sort of tear these little annular fibers if we've lifted badly, or we do a repetitious movement. So basically somebody's bending forward a lot all day, or sitting badly, slumped. It just puts lots of strain on through the disc, because sitting increases pressure through our discs. And eventually over time, the soft center can come out and hit through onto the nerve, and that's when you get sciatica. Now, classically, sciatica takes about 6 weeks to get better, I mean, that's in the short term. You know, it can go on a bit longer than 6 weeks. I think you're doing quite well if you get rid of sciatica in 6 weeks. The other thing I want to say is that you can get sciatica at almost any age. So between 20 and 60 are the most common areas, a really wide range group, because, you know, younger people, 40-year-olds can get classic disc problems. And then our older population can get spinal stenosis, and this is a degenerative thing. So if I go back to our little thing here, basically this is our facet joint, and all this area can get worn out, and you get little bony growths that grow all around here and around here and around here. And so classically, spinal stenosis impinges on the spinal cord, or the spinal contents, because in our lower back, our spinal cord ends at in our upper lower back, and we just normally have a load of nerves that come down here and then exit out through these little holes. So little bony growths can then compress this area. So basically it's a compression of where the nerve comes out, and that's what causes our sciatica. So another thing which is reasonably common to see is something called spondylolisthesis. It's where one vertebrae slips forward on another, like so. And again, that impedes this area as well. And generally with the spondylolisthesis, you can have disruption because there's quite a lot of pressure that separates the disc. So, our last thing is the Piriformis Syndrome. Now, Piriformis is a muscle in our bottom, and it runs from our sacrum to our upper thigh bone. And it's basically a muscle that causes external rotation, or turns the feet and the legs out. Now, the sciatic nerve generally goes underneath this muscle, but sometimes it can go right through it. In a certain percentage, a small percentage of the population, it can go right through it. So if it's underneath and this muscle gets tight, it can irritate the sciatic nerve. And this can be a postural cause for this, generally is. Sometimes you might have done something earlier on in your life and hurt your back, and you're not quite resolved with problems, and then the muscle, you basically overuse this muscle, and it gets tighter and it can irritate the nerve. This sort of thing is pretty easy to sort out with manual therapy, actually, and a few acupuncture needles can really help to settle that down, that muscle. So how can you help yourself to start with? Well, don't sit for longer than 20 minutes. And I think basically, if you have a disc problem, you won't want to sit for longer than 20 minutes because you'll be in quite a lot of pain. Because obviously when we sit, we weight bear much more through our discs. You really want to try and ice and heat the area. So contrast bathe, make sure that you wrap your ice in a damp tea towel, and also try and use a proper heat pack, because you can also burn yourself with the heat. And so just do that 5 minutes of one, 5 minutes the other, and do it on your lower back rather than actually on the leg, because lots of people put it where they feel the pain, and generally, you know, the pain isn't being caused in your leg from sciatica. Now, obviously, medication, this is a tricky one, because a lot of the anti-inflammatory medication doesn't really touch the pain, to be honest. And you probably want to see your GP. If you're in a lot of pain, you want to see your GP, and he can prescribe other medications to help you with your pain. Because as I said, at night, the pain is sort of unrelenting and you just cannot find a comfy position. So in the day, make sure that you are pottering around, you're moving about, but not doing really heavy lifting. So not bending forward and trying to lift things up. Just avoid too much bending forwards if you can. And then if you're at home or at work where you can just lay down for 10 minutes, lay down, and I'll show you a position that you can get into to try and help you be more comfortable. And just take 5-10 minute rests and do a few of those in the day, because, you know, if you aggravate your symptoms in the day, you're going to pay for it at night. So you want to keep the inflammation down in the day so it just doesn't sit and pool around that area at night, because that's why we get worse at night, because we're still and we're not actually physically moving. So don't bend and twist at the same time. So don't bend and then rotate, because that follows the shear of the annulus. You know, I talked about the disc. that follows the shear of the disc, and that can really exacerbate the disc prolapse if you actually do have one. And just nice guidelines at the moment suggest that manual therapy and exercises are one of the best ways to try and help reduce sciatica, which is good. So this next picture shows a comfortable position that you can lay in at night to try and get comfortable. I would tend to use probably another pillow or two, especially in the day. I'd get my legs right sort of at a V shape with pillows underneath, so it just takes the pressure off that lower back and off the sciatica, because once you bend your leg, it takes the pressure out of the sciatic nerve. So you can also lay on your side and put a pillow between your knees, and that's another comfortable position because your knees again will be bent in that position. So it just takes the strain out of and the pressure out of the nerve. So what exercises can I do? Well, that's for our next vlog. Next week, I will show you a few exercises that you can have a go at to relieve your sciatica. So I look forward to seeing you next week. Have a good week. Take care. Bye-bye.